Yeah, Stanley Decides MD, FACP, Fellow of the American College of Physicians. I'm most proud of when I first came to CAPE. When I first came to CAPE, I was just out of my fellowship training, so I had to present myself to the Southeast Hospital administrator and the St. Francis administrator. First, I went to Southeast Hospital, and there Jim Stryker gave me the key so I could get in the emergency room gate. But he sat me down and told me a bunch of things that he wanted me to know. First, he wanted me to not treat acute leukemic people in Cape Girardeau. Second, he had several other questions about aggressive cancers that he didn't want me to treat at CAPE. After that, I came to St. Francis and over on Good Hope Street, the old hospital, and met Sister Virgilia. And Sister was just open and very sweet and nice. After about 9 months in CAPE, Dr. Talbert asked me to see a patient on the floor who had an acute MI. He was 63-year-old Harold. I was to see him because his blood counts were very low. So I went down to the lab and Glenn McFadden made me a blood smear. And I saw it was clear he had acute leukemia. And that was probably what led to his heart attack. So with that, I called Washington University, called the great Ed Reinard at Barnes. I said, I have this patient who's had a heart attack. And Dr. Reinard says, Stan, I've looked at your credentials. You're board certified in hematology. You can do just as well in CAPE as I can at Barnes. I had to parse through that. So finally I went down to pharmacy at St. Francis, and tucked under the stairways was the pharmacy. It was fairly small, but there was Sister Goretti. When you face Sister Goretti, Sister Virgilia was pretty easy. And we had others, I remember Sister Maureen and a bunch of others. You better have your stuff together if you're going to talk to Sister Goretti. But she was so kind. And I said, Sister, we have this patient and he has acute leukemia. So I need these 2 drugs to see if we can give him a little more life to live. And she says, well, doctor, we've never used these drugs in CAPE and I'm unfamiliar with him. But if you feel he needs these to live longer, I'll try to get them. And I told her I needed cytosine arabinoside and daunorubicin. And about the next day, Sister Goretti had gotten these somehow, and we started him on 7 days of cytosine arabinoside and 3 days of daunorubicin. And after about 2 weeks, he improved to the point he could go home. But back then, you had to, a month after you started, you had to restart those same chemo drugs. And he came back in and we retreated him. And then a month after that, he ended up getting consolidation therapy. And a month after that, he got his 4th and final treatment. And he went on to do very well. It was 3 years before he finally passed away. But this to me always was sort of the importance of the caring at St. Francis. Sister Goretti had never heard of these drugs, they'd never been used here, but if it would help him have a longer life, she would get them for me. And he went on to do very well. Well, with that, just about all the acute leukemics were treated at St. Francis Medical Center. By then we moved into the new building. Some of those are still alive in CAPE. Some are young. And one of my joys is to go out and walk about and meet some of these at places like Walmart or elsewhere, and we reflect on these old days. How did it shape my life to practice at St. Francis? In a group like internal medicine group, you have to have good partners who are willing to share with you coverage and such. And I think one of the things is that St. Francis always was a place where we could get good coverage, we could get questions answered. But for me, the core was that group of nurses who found out they liked treating people with hematologic disorders. And that formed this group of people that really began developing hematology and oncology at St. Francis. You need to go to the institution you're looking at and see what their attitudes are. How much do they really care? This is all about your level of caring and meeting of needs of the patient. So go first and go to a place you think that not only will you enjoy practice, but the people around you care. Is there a word that conveys the meaning of St. Francis to me? I guess it would be much the same word, but heartfelt caring. The old breed of doctors like me weren't trained nearly as well as these new, young medical oncologists and also hematologists. These specialties have been sort of split. You tend not to get boards in both of them. Hematology includes many diseases that aren't due to cancer. Medical oncology has gotten so complex that even medical oncology requires specialization. When I came to Cape Girardeau, Washington University, Barnes that is, had 6 hematologists and oncologists. Now it must be near 100. These are so highly specialized today with very aggressive medicines that also are very toxic. So no, we were all sort of generalists of hematology and oncology when I first came here, followed by my partner Brock Wittenberger. Today even the specialty is highly subspecialized. There were 2, Charlie Bond and Gene Chapman were the heads of the internal medicine group. Later, when we added pediatricians, Jean Deemer, Sarah Eit, Sarah was boarded in both peds and medical oncology. Then we changed the name from internal medicine group because now we have pediatricians. But certainly Charlie Bond and Gene Chapman were wise physicians that really would help mentor we young guys just getting out of our training and coming, such as Phil Taylor, Jim Zur, and a bunch of others, Tony Safuto. I think what interests me is the nurses that I had an opportunity to sort of invest in that helped me do bone marrows, that helped me do procedures of the specialty. I remember people from the lab that were so important, who would always make sure they'd make a blood smear for me so I could look at blood smears of my patients. Glenn McFadden was head of lab in the older St. Francis, and he was so good at making sure if I said I really need a blood smear of this patient, of making sure we got one. There was a lot of support. Marilyn Curtis followed him. So I think not so much as helping the doctors, because the new guys coming are well trained, they don't need my help, but working with the people in the lab, people in X-ray, that's been one of the real gems for me. No, I think we had a lot of real pride when we developed our own oncology floor, which was, I guess, 4 East. We were busy enough that most of the patients there were oncology patients or hematology patients. No, we've had a bunch of real successes as far as improvements in the way the hospital was arranged to accommodate what we needed. That's all changed today because so much has moved outpatient. But still, there's a real need for a floor where nurses are attuned to the drugs you're using and procedures for the patients. Sure.